Okay. Hi guys, this is day 2 of my orbital decompression. I had it done yesterday at around probably closer to 9 a.m. They did my right eye, this one over here. There was a picture taken of comparing this eye that's still bulging and the other one. It was a pretty significant change. Right now, the swelling is pretty prominent. It's gonna swell a little more and more, and the swelling doesn't go down until probably between 1 to 3 months fully, to where there's no swelling and the eye is in place the way it should be. Obviously, they did 2 little incisions, so I'm just gonna use this eye for example because I can't touch this eye. Right here and right here, both medial and lateral corners of the eyes. They put stitches over them. They dissolve on their own, obviously. And then there's stitches inside my eye on the bone. Those take a while, probably about the 1 to 3 months to fully dissolve. I could open my eye a little more than yesterday. It's still pretty painful. It's just uncomfortable to move this eye like sideways. I could open the eyelids a little, but it's still pretty uncomfortable. It looks way worse than it feels. It really just gives you a headache and just obviously uncomfortableness on your eye that was worked on. And just pressure because it's swollen on and behind the eye, obviously because you just had surgery back there. Other than that, honestly, compared to other videos I've seen, I don't seem to have major swelling. I've seen way worse people on YouTube with more swelling and bruising. I think I have a little bruising somewhere around here. Over here is just blood. Your tears are blood for the first day, like day after surgery. Day of surgery, after the surgery. And probably a little day 2 maybe. I was prescribed 3 medications, 1 for pain, 1 for nausea, and then hydrocodone, which is just, it was for pain too, but it's like extreme pain, which you don't really experience. I guess it was just in case thing. I've only taken the normal pain one. It starts with a T. I forgot what it was called, but that one's fine. The nausea medication they prescribed me, I think I don't react to it well because it actually made me nauseous. Both times I've taken it when I wasn't nauseous. And then I threw up. The day you get the surgery and you come back home after, they said that there's going to be blood in your stomach, and so when I threw up there was some blood in there, but that's normal. Vomiting blood and crying some blood out, completely normal. You're not supposed to blow your nose, like a full out blow, because that is connected to behind your eye, your sinus and everything is connected, so it would rupture the stitches behind your eye, and you'll know if that happens, it would be super painful, I suppose. So no blowing your nose. I have a bad habit, I kind of like blowing out a little, but that's not a full out blow, but anything like that I'm trying to avoid anyways. You're supposed to apply this ointment they give you to the 2 corner stitches 3 times a day, and then another time, but in the eye, so where you could open your eye a little, you just kind of put it. You're not supposed to open your eye, like fold like this, like fold the eyelid up or fold the eyelid down on the eye that you had the procedure on. So you're just supposed to open it to where you could, and then put the ointment in, and it will go around the full eye on its own. Then you're supposed to ice your eye 20 minutes every hour, so 20 minutes on, 40 minutes off, so on, for a few days. I haven't been doing that too much, as much as I was told to, but my swelling isn't that bad, so I don't think it's really affecting me. If my swelling was worse, I would definitely be trying to do that more, but I've just been sleeping for the most part, so I don't really have time to do that anyways. Yeah, I was super nervous before the procedure. I almost wanted to cancel it, but obviously at that point when you're strapped in the bed, not strapped, but when you're in the bed in your hospital uniform thing, can't really back out of that. But yeah, I was shaking the whole time. My whole body was like this, my legs. And the anesthesiologist came out. He put the anesthesia in my IV, and then right away I started getting really droopy and drowsy. And they rolled me back to the OR. I remember being awake for some of that at the beginning. I just passed out. What I didn't know with the anesthesia is they put a breathing tube down your throat, so you could breathe during the while you're under anesthesia, because it's a really strong anesthetic, so they have to make sure you're able to breathe during it. So, but when I woke up from the whole procedure, I started waking up at the end when they were done. My throat was just in horrible. That was the most painful thing of this all, is your throat, from the them pulling the tube out at the end, because they have to do it fast. I've heard they have to pull it out fast, so it'll hurt the least, but it still hurts so much. And I remember waking up from the being put under at the hospital, while they're waiting for you to wake up. My throat just felt like it was closing up, and I couldn't breathe like normal or talk, so it took me a while to kind of cough it up. And your throat hurts. My throat hurt badly until probably midnight last night to this morning. It doesn't really hurt anymore. But honestly, that's the most painful thing of this all for me personally. I'm not even needing to take my pain meds because it's not all that painful. I keep trying to open my eye, but I think you're supposed to just let it be closed. I just practicing how much I could open my eye every day, but it's just a little painful doing that, so I'm just going to keep it closed. But I try to, at least. I'm really stubborn. And I thought that operating on one eye at a time, I would have the other eye open to where I could see and go about my normal routine and see at least through one eye, just as if you were closing one of your eyes. But that's not the case. You could barely open the eye that they didn't operate on either, because the eyes are kind of connected. So if I try to open this eye, even just slightly more than how it is, this one tries opening and it's just painful. So you really just need to keep both of them closed. And this one, that's as far as it goes open on its own. So it's weird. I wasn't expecting that, but I have my parents, my little sister, and my boyfriend here to help me do everything. I was able to eat a dinner last night after the surgery. Since they don't tell you, they say you can't eat since midnight the night before. I was super hungry coming out of surgery. I felt sick because I was hungry, because I tend to get really sick when I'm hungry. So I got home. I tried eating some chicken noodle soup and crackers and Gatorade. you're supposed to eat light things like the crackers and Gatorade. Probably would have been fine, but I threw up because of the chicken noodle soup, I think. But also could have took the nausea medicine before, and that just made me feel even worse. So I threw that up. Stopped taking the nausea. I'm never taking that again. Those pills. But then at probably around, I don't know what time it was, 8 or 9 p.m. I was able to eat a full dinner. I ate a lot. I was really hungry, and I was able to keep that in, and I didn't feel nauseous. I guess after the procedure, the anesthesia is still wearing off slowly, so it's probably why I also threw up earlier. But yeah, I can't see how long this video is. They say you're supposed to have double vision the first few days. As far as I could tell, I don't have any double vision, but also I can't really open my eyes enough to where I could see, and I wear contacts or glasses, so everything's blurry anyway. So maybe if I had a contact or glasses on, it would be double vision, but I don't know. So far I can't tell that I have any. But yeah, there's no point in putting one contact in your procedured eye, because I feel like that would just give you a major headache. I can't put my glasses on because the swollenness of this would probably touch the glasses. I feel like it's not that swollen though, because my protruding eye, normal eye that's still protruding, it goes out way more than the swollenness of my worked on eye. So these would probably touch my glasses more, but I don't know. So yeah, this is day 2. I haven't had trouble sleeping or anything. Everything's going good. My body recovers fairly well and fast. I've just been like that my whole life, so I think this is gonna go pretty smoothly. The only thing that really sucks is the day of surgery, and then going home the same day after. It's just pretty rough because of the anesthesia and all that. I just can't wait for me to be able to open my eye, this eye, until where it won't hurt. Trying to look around and opening it, but I don't think you could open it fully until the 2 stitches on each corner dissolve, so it might be another day or 2 for that. But yeah, I had to take my nose ring out for the procedure. And before this happened to me too, having my nose ring pierced for almost a year already. It fell out at night one day, and then I couldn't put it back in the next morning. It had already healed up and closed, like the skin already grew back. So like I heal really quickly. It's scary. Because your nose is supposed to heal. Nose rings are supposed to heal after a few months. Probably, I don't know exactly, but probably max, I would think 6 months. You should be able to take it in and out whenever you please, which is not the case for me. So I had to take it out before my procedure, and it closed up already. So, but yeah, I'll keep posting in another day or 2. Keep you guys updated. Thanks.